Hello and good morning, everyone. Hope everybody is keeping well. First of all, thank you so much for subscribing to my channel. Today, we are going to discuss health. Instead of discussing the diseases, we are going to discuss health. So, what is health? It's a state of physical, mental, emotional, and spiritual well being. We are going to touch upon the topics related to the physical health. So we really need to keep a lot of things in mind when keeping in good physical health, which includes good nutrition, good physical activity in the form of workouts, walks, jogs, any games, whatever you like. And other thing aspect is, as per our age group, we need preventive healthcare checkups. So why do we need those checkups? Because first of all, if we'll know the deficiencies, then only we'll be able to fulfill those. And secondly, if there are anything which are in abnormal situation, abnormal stage or range, any test, we can cure it at the earliest, and it's much easier and a better way to lead a healthy lifestyle. Because in today's lifestyle, stress has taken a toll on everybody's physical health, everybody's mental health. Preventive health checkups. With the increasing stressful lifestyles and pollution level, our body is constantly at a risk of developing various chronic medical health conditions, and sometimes even it can be life-threatening conditions. In such a scenario, we need regular preventive health checkups as they are very important in identifying the early signs of any health issues, which can further cause any serious complications, and initially they are obviously easier to treat. So it is advised that all adults they go for the regular preventive health checkups from time to time, and even when they're healthy. So what do we define time to time? Many factors such as age, health, family history, lifestyle choices, they all impact your health and well-being. And according to all those things, like if your family is having a history of diabetes or hypertension or any cardiovascular disease, so we need regular checkups from like 3 to 6 months regularly. So that is what time to time means. So, what are the benefits of preventive health checkup? There are so many. First is the timely detection of potentially life-threatening health condition. For example, heart attack. So usually it is because of your vascular blood vessels, vascular structure to the heart is being blocked by plaques, which are caused by the accumulation of the cholesterol. And more prone are the people with having diabetes and hypertension. So early detection of diabetes, early detection of hyperlipidemia or high cholesterol levels and hypertension, they can all prevent the further complication like heart attack. So preventive health checkup will also provide information on the basic cholesterol levels, basic blood sugar levels, and your basic routine tests also. So it puts you at a lesser risk of getting sick. So it can definitely improve your life expectancy, reduces the healthcare cost over time, because if you get into a disease, definitely you'll need a treatment. Definitely indirectly it increases your cost over time, morbidity also, and mortality chances also. So it also helps in reducing the unforeseen medical expenses. And at initial stages, timely treatment can help manage it, and it's much easier to get treated at the initial stages. A delayed detection obviously will result to expensive treatments and may prove fatal also. So it reminds you of your importance of your healthy lifestyle. So these are all the benefits. That is lesser risk of getting sick, timely detection can prevent life-threatening condition, increases chances for the right treatment, and of course reduces the complication risk. So what are the tests covered in the preventive health checkups? So it includes various type of like heart disease, diabetes, metabolic disorders, liver, kidney, and other chronic conditions. Apart from screening, it can also measure basic your levels of cholesterol, blood sugar, and other all biomarkers, which we are going to discuss soon. So the most important thing is you always need to get tested from an authentic or an accredited laboratory, because all these tests and their reports are going to help with the diagnosis of any disease, if any. And of course also with the importance lies with the fact that the good machines and the good infrastructure and a good doctor to actually tell you and interpret the reports is very very important and very crucial step, as in today's world the all diagnosis of the disease and everything depends on the reports from the laboratory. So always go in for the authentic and the best laboratories, and please kindly do not try to save few bucks and compromising your health. So what are the tests which are needed? Usually commonly done are the CBC, that is the complete blood count. So it is most commonly ordered. It will actually monitor in your blood disorders. For example, your hemoglobin, your TLC counts, your differential counts, your platelet levels, everything. So another is a lipid profile. It is a profile to check for the developing cardiovascular diseases. So it will actually measure your total cholesterol, triglycerides, HDL, which are the good cholesterol, and LDLs, VLDLs, and total cholesterol. So next is the liver function test. It is definitely used and very, very useful and for the evaluation of the liver disorders, which includes SGOT, SGPT, ALP, GGTs, albumin, globulin ratios, etc. In the kidney function test, we actually evaluate the proper functioning of kidneys by checking for the blood urea, creatinine, uric acid, BUN, and electrolytes. For the blood sugars, we can always screen for the pre-diabetes, diabetes, or gestational diabetes and monitor the efficacy of the medications. In this, fasting blood sugar, postprandial, and random blood sugars. HbA1c is a 3-month sugar. I have made a different video on HbA1c. Kindly go and see that HbA1c video for the further detailed information on the diabetes profile. Another test is the thyroid profile. It measures the T3, T4, and TSH hormones level in the body. It is very important because it's a metabolic disease, and there are many patients who might be having a common hypothyroidism situation where the symptoms can vary from excess of sleep, weight gain, weight loss, excess of eating, binge eating, no eating at all, or there could be muscle weaknesses, anxieties, heart rate increased, heat intolerance, or there could be a cold intolerance, there could be depression. Many symptoms are there depending upon the situation, which could be hypothyroidism, which is a reduced thyroid, or hyperthyroidism, which is an increased thyroid. The normal state is called the euthyroid state. Another test is the vitamin D. It measures the level of vitamin D in the blood. It is very, very useful and very, very important in Indian setup because these days we are not really exposed to the sun, which is needed for the formation of the vitamin D. So maximum population is deficient in vitamin D, and thereupon it affects your bone and of course your other well-being. So we really need to get tested for the vitamin D. Another test is vitamin B12. This is more common deficient in vegetarian people. People who are taking eggs or meat or any other non-vegetarian or mixed diets, they usually are okay. But people, specifically vegetarian people, they are usually deficient, and we need this on the daily basis because vitamin B complex is a water-soluble vitamin and daily dose is needed. It's very, very crucial for the blood formation for the RBCs and other things. Another test is the urine routine examination. It tells you about any UTIs or anything regarding the urinary tract infections. So don't wait for the disease to knock at your door. Book a preventive health checkup package today. You can call us for the further details at the given numbers. So these are all the details of the packages we have for the preventive healthcare. These are the basic healthcare packages. There are certain offers for the iron profile. Iron profile is more or less needed in a fertile females. That is from the age group of, like, you can say 13 to up to 45 because there is a iron loss. There is a blood loss in menstruation. So usually females have lesser of the hemoglobin. So we need to get iron profile tested. Other routine health packages are available, which include all those tests mentioned. There are various packages available depending upon your need. So fever profiles, there are senior citizen packages for the males and for the females. There are full body checkups. There are allergy tests. These are also comes under the preventive health checkups, or in those people who are suffering from allergies, because by and large initially they may show allergic reaction, but chronically it may cause respiratory illnesses or gastro problems. So that is also one of the crucial testing which usually is missed. Other packages according to the disease you are carrying or the family history. So we can have diabetes profile, osteoporosis panel, arthritis panel, PCOS or PCOD panels, more commonly used in females, of course, in the younger females, to be on the good part. Anemia panels are there. So apart from this, we can always customize the panel as per the need of the patient or as per the age or the disease status or the health status. So feel free to ask questions. Thank you so much.